Hi everyone, my name is Dr. Phen. I'm going to be taking a couple moments here to explain to you about a life-changing treatment that we do here at Secure Dental. We are going to be discussing full arch dental implants today. Kathleen presented to us with concerns about an inlay and a bridge on her upper right. They'd been giving her problems and she was looking for a much more permanent solution. One of the options that we gave her was the fixed full arch with about 4 implants at the top and a zirconia bridge. Miss Kathleen was very excited about this procedure and wanted to get started, but we need to make sure that we can do our diagnostic workup. So every single patient that comes in, we make sure we do a diagnostic workup, which includes checking the bite, checking the space, making sure that their facial structure, making sure that their TMJ, everything is functionally sound. And then what we do is make our designs. We do smile designs. We make sure we have our plan ready before the day of surgery. The day of surgery, Kathleen comes in. She has taken her medications as was discussed previously. Make sure that each patient has to take whatever pain medications, whatever antibiotics that they're required to do before surgery. And then they're able to be scheduled to sit in for what is going to be around 4 to 6 hours for one arch. Now, Kathleen came in and she completed extractions as well. She finished extractions and placed 5 implants up at the top. And sometimes what happens is during the planning process, we have to be able to pivot during the surgical process if we're finding discrepancies or issues with the planning. Doesn't happen often, but when surgery time comes, it's a very variable field that we have to be able to assess if this plan is still viable or not. So Kathy came in for extractions, and after we completed those extractions, in order for us to have a good solid foundation, we had to do both grafting, which means placing new bone onto the holes that were left inside the teeth after we inside the jaw after it was extracted. And then we go ahead and do an alveoloplasty, which is essentially bone contouring to make sure that we can prep the final bone contouring to the appropriate measurements. After we place the implants and we are putting the MUAs, then we go ahead and take some scans, make sure that we get all of our data, and then we go ahead and begin the suturing process. After the suturing process, we then go ahead and put some medication into the gums to make sure that we get pain and swelling management for the next few days so that the patient can be as comfortable as possible. The patient then came in the next day for her temp delivery. Sometimes we're able to do the delivery on the same day. Sometimes we would have to wait until the next morning. Again, this goes by case, but you could generally expect them within 24 hours. So when we come in for the follow-up visits and we make sure we can get as much information as we can from the patient, we're also checking to make sure that their function and aesthetics is in line with each other. Now for Kathleen, she really wanted to make sure that her upper teeth looked a little bit more flush with the rest of her smile line, and she has had a couple problems regarding teeth that are flared out, maybe not as aesthetically ideal. And so what we do is that we work with the lab using old reference photos as well as smile design metrics to be able to come up with a design that the patient and the provider is happy with. So after trialing a few temporaries, depending on what is going on with the patient, we make sure that when they're getting to the point where they feel satisfied with it, aesthetically and functionally, then we go ahead and process that to the final zirconia prosthetic. We send the designs to the lab. They go ahead and mill out the design, and then they deliver it to us so that we can have it installed into the patient's mouth whenever they're able to come back in.